Welcome to our presentation on how to apply for your Alberta Healthcare Card. This presentation was made in partnership with MacEwan University nursing students and the staff at Knee Hill Adult Learning Society. Alberta is a public healthcare system. Alberta's public healthcare system is publicly funded. That means that medically necessary hospital and healthcare services are free in Alberta. In simple terms, if you are sick and treated in the hospital or clinic, you will not have to pay. To get this free medical service, you just need to have an Alberta Healthcare Card. In this presentation, we will talk about these topics. Registering for an Alberta Healthcare Card. What to do if your coverage is denied or cancelled. Adding or removing family members from your coverage. What to do if you lose your Alberta Healthcare Card. What is covered under the Alberta Healthcare Insurance Plan. How to use Alberta Health Benefits. How to extend your healthcare benefits while waiting for PR. Use the chapters menu in the video description below to jump to a specific topic. Getting your Alberta Healthcare Card. To get an Alberta Healthcare Card, you must first apply for one, which is like asking the government to give an Alberta Healthcare Card. There are 4 steps to applying for a card. Your first step is to see if you are eligible. Do you meet the requirements needed to get a card? The second step is to complete the application form. The third step is to gather and provide the supporting documents that confirm your personal information. Finally, the fourth step is to submit the application. We will now go over each in detail. Determine your eligibility. You are eligible for Alberta Healthcare Insurance Plan coverage if you are legally allowed to stay in Canada and have residence in Alberta. Are planning to stay in Alberta for at least 183 days within a 12-month period. Do not have health insurance or benefits from another province or territory. You are not eligible for healthcare if you are currently claiming protection as a refugee. The claim for refugee status is refused or failed. Immigration documents are expired. You are in Canada under a visitor visa. Temporary foreign workers and their dependents are eligible for health care. If you are moving from another province or territory, maintain your health care from that province unless you intend to live in Alberta for 12 months or longer. If you come to Alberta on a work permit and plan to stay in Alberta for at least 12 months, you can apply for a healthcare card. Your permit needs to be valid for at least 6 months to qualify. As a temporary worker, keep in mind that your Alberta Health Card will have an expiry date. This date should be the same date as the valid until date on your Canada entry document. Your coverage will end on that date. Download and complete the application. You can download the form from the QR code provided. Once you have downloaded the form, you will need to fill it out. When you have completed the form, print it off as it needs to be submitted either by mail or in person at any Alberta registries. You can also obtain a copy of the application from Knee Hill Adult Learning Society, where they can assist you in filling it out. Completing the application. The first part of the form begins with your personal information. Your mailing address is the one which you will receive letters in the mail with, which in rural areas will be your post office box number. They ask for your mailing address because they will send you the card in the mail. Your home address is your house number and the street on which you actually live. Both will include the city, province, and postal code. Section A of the form asks you about your residency status. If you are not a citizen, you select No. If you have a permit or visitor record, you will have to include the dates. Section B asks you if you have had Alberta healthcare in the past. If you are new to Alberta, you will select No. If you have lived in Alberta previously and had a health card, then you will have to provide your old number along with the name you registered under. Section C asks you why you are applying for healthcare. Most temporary residents will select the new resident option. If you are coming from another province either as a student or worker, then you will select one of these two options. Section D asks you about how and when you came to Alberta. You will only need to write which country or province you are coming from. You won't need to write the full address. Next, you will need to write the date that you arrived in Canada if you came straight from your home country or another country to Alberta. This may or may not be the same as when you received your permit. You will also have to write the date you arrived in Alberta, whether you came from your home country, another country, or another province. The last date you have to record in this section is the day you decided that you would live in Alberta permanently. If you came from a different province or territory and have healthcare there, you will have to write the plan number. You will be able to find this on your card. Section E simply asks you about if you are planning to stay in Alberta for 12 months or longer. If you aren't, then you need to tell them how long you are staying and the purpose of being in Alberta. Once you have filled out Section A to E of the form, you will need to write down your phone number, the date you filled out the form, and you need to sign it. Details of your spouse or partner. If you are married or living with a partner, only one of you is the main applicant for a healthcare card. The person applying adds their partner or spouse in the same application. All of the questions will be the same as the main applicant. They will have to sign, date, and provide their phone number as well at the end of their section of the application. Adding dependents. On this page, you will enter the information about your children. You will have to fill out one section per child, so you may need a few copies of this page. Your next step in this application process will be to gather your supporting documents for everyone listed on your application. This chart shows you what document you will need for each person. You will have to provide proof of residency, a document that has your street address on it. Proof of identity, a document that confirms who you are. Legal entitlement, a document that proves you are legal to be in Canada. Examples of the types of documents you will need. You will only need one of each. Your Alberta residency. That is, proof that the street address of your home is located in Alberta. Your identity, either passport, driver's license, or an ID card with a photo. Legal approval to be in and remain in Canada. This would be the immigration document you received or showed upon entry to the country. If you do not provide these documents, they cannot process your application. You might also need to provide more documents to confirm your Alberta healthcare insurance plan eligibility. Submitting your application. The application can either be sent to the Alberta Healthcare Office by mail, or you can go to a participating registry in person. If you are submitting in person at a participating registry, the process time is faster. It can take up to only 5 days. Make sure to bring your completed application form and your original documents to the participating registry. There is no charge for this service, it's free. The locations of 2 local registries, Three Hills and Bizaker, are provided at the end of the presentation. When the card is ready, it will be mailed to you by the Alberta Health. If you are submitting by mail, know that the processing time may take up to 6 weeks and can be longer during cold, snowy months, from October to February. Make sure to send your completed application and the photocopies of supporting documents inside the envelope to the Alberta Health Office. On the outside of the envelope, make sure to write the Alberta Health address, which is provided on the slide. Include photocopies of supporting documents with your application. Do not send original documents in the mail. Photocopies must include front and back of the document, if possible. When this is completed, you can then send the envelope to the Alberta Health Office for processing. When the card is ready, it will mail to you by the Alberta Health Office. Ensure you provide your current mailing address. Once more, The most important thing here to remember is that you do not send original documents in mail. Please scan or photocopy them and then send the copy in the mail. What to do if your application is rejected or your healthcare is cancelled. This can happen for different reasons. Your Alberta healthcare insurance plan application may be rejected, or your current coverage may be cancelled if the documents you provided are not acceptable, are expired, or if you do not meet eligibility requirements. If this happens, what to do next? You can appeal the decision by requesting an eligibility review for healthcare coverage. This means your application along with any new supporting documents you submit will be reviewed. Remember, it is your responsibility to prove that you qualify for Alberta healthcare insurance plan coverage. Make sure you provide enough evidence to the Alberta Health Office. To request a review, send an appeal by following these steps. First step, write a letter explaining why you are appealing and why you are eligible for healthcare coverage. Second step, include any new or additional evidence to support your eligibility. Third step, send your appeal letter to the address listed on the screen. Alberta Health will review your application and send you a letter with their decision and the reasons for it. Sometimes the number of people in your family can change. If you need to make changes to add or remove family members from your Alberta healthcare insurance plan coverage, you can go to the Health Card Updates government website and download the form that applies to you. After you fill out this form, you have two options on how to submit your form. The first is to go in person to a registry's office. Note that this is a free service and processing time can take up to 5 days. Or you can mail it to the Alberta Healthcare Insurance Plan office, and once updated, the healthcare cards are mailed to you. Accidents happen. We know that it is possible to accidentally lose or damage your Alberta healthcare card. So, what to do if you lose or damage your Alberta healthcare card? If you have lost or damaged your Alberta healthcare card, you can get a replacement card. Do not worry. Call 780-427-1432 to order a new card. When you call this site, they will give you two options. If you know your health number and your current address is in the system, press 3 and follow the prompts. If you do not know your health number, press 0 to reach operator. Once processed, replacement cards will be mailed to your address from the Alberta Health Office. A great tip is to laminate your card to protect it from getting damaged or dirty. Now this is the easy part. How do you use your card when you are feeling sick? Every time you go to the hospital or clinic, you will need to present the card to the receptionist at the front desk. When you provide the card, all they are doing is making sure your card is valid, and they will input your information into their records. If any services are not covered, they will let you know so you can make your own decisions regarding accepting the services. Remember to carry both your Alberta personal health card and a piece of government-issued ID. Not all medical services are covered by your Alberta healthcare card. Full coverage means there is no charge for certain services. These services are free. Medical services that are fully covered include visits to the doctor or medical clinic, including pregnancy care, psychiatrist visits, general surgery services that are related to your present illness. When you are in the hospital, many services are covered, such as laboratory, X-ray and diagnostic procedures, meals and staying in a shared room, medications given to you inside the hospital, services offered inside the hospital, and transferring you between hospitals in Alberta by ambulance. Eye doctors. Children under 18 years old and adults over 65 years of age are eligible for one complete eye exam, one partial exam and one diagnostic procedure per benefit year. Now let's check what is not covered. No coverage means that you have to pay full price of the medical service even if you show your Alberta healthcare card. Services that are not covered are often those that are not medically necessary or services that help you get better after a hospital stay. Medical services that are not covered include cosmetic procedures, chiropractor, acupuncturist, massage therapist, nutritionist, psychologist, and other therapies not referred by a physician. Routine eye exams for residents 19 to 64 years of age, laser eye surgery, eyeglasses, and contact lenses. Dentures, dental cleaning, fillings, and wisdom teeth extraction. Prescription drugs. Vaccinations for travel purposes. Hospital services that are not covered include private and semi-private hospital rooms, ambulance, hearing aids, medical and surgical appliances, prosthetics, supplies, mobility devices. If you have any questions regarding what is and is not covered, you can call HealthLink at 811 or you ask the staff when you go to receive a service. How to extend your healthcare insurance while waiting for PR. Your healthcare coverage starts when you move to Alberta or when your Canada entry document is signed, whichever is later. It lasts until the expiry date on the document you submitted with your application. Remember, if your document is renewed or extended and you're still in Alberta, take the new document to a participating registry for processing. If you cannot go to a registry, you can fax it to the healthcare office. Extending your healthcare insurance while waiting for PR. If you plan to remain in Alberta, apply to Immigration, Refugees and Citizenship Canada, IRCC, early for an extension of your Canada entry document or current IRCC document before it expires even if you have applied for permanent resident status. If you are a temporary foreign worker and have received a letter from IRCC that confirms you are permitted to continue working with the same conditions until a specific date, we will accept that letter as a new permit and continue to provide Alberta Healthcare Insurance Plan coverage to the date stated. These letters and your latest work permit can be taken to a registry for processing. If you have family members who have applied to extend their IRCC documents, bring confirmation letter that their applications were received by IRCC so they may be extended as well. First extension. If your immigration document is expiring soon or has expired, you may be provided with an extension of your Alberta Healthcare Insurance Plan coverage while you wait for your new document from IRCC. You must be currently living in Alberta. Be recently enrolled in Alberta Healthcare Insurance Plan coverage. Have not received a denial from IRCC regarding your application to extend. Be able to provide the date of application and the application number from IRCC that confirms you applied to extend your work or study permit or visitor record before the expiration date. If you meet the above criteria, contact Alberta Healthcare Insurance Plan. The first extension is up to 90 days. If you received a letter from IRCC denying the extension, you must contact Alberta Healthcare Insurance Plan to have your coverage cancelled. Applying for permanent resident status alone does not grant you an extension of your Alberta Healthcare Insurance Plan coverage. Second extension. Temporary foreign workers who have reached the end of their 90-day extension may be eligible for a second extension up to 90 days if they are still working. Have not received a letter denying the new permit. To request a second extension, email the email provided on the screen and include confirmation of your employment, your most recent pay stub and a letter from your employer confirming that you will continue working there. Submit this information no earlier than 1 week before your coverage expires. A copy of the confirmation from IRCC that they received your request to extend. Any other information that may be pertinent. When you receive your new work permit, please take it to one of our participating registry offices for processing. Paying for healthcare while waiting for a new Canada entry document. If you are not eligible for Alberta Healthcare Insurance Plan coverage, you are responsible for paying for any future health services you receive. If your new document from IRCC has restored or maintained notes, your Alberta healthcare insurance plan coverage might be reinstated and backdated to when it was cancelled. You may be reimbursed if you were eligible for Alberta healthcare insurance plan coverage when you received a health service. To get reimbursed, contact the office where you received the service, give them your personal health number, and ask them to submit a claim for payment to patient. Just a reminder that this presentation has a brochure that will contain access to most of the links and key information that you saw in this presentation. Check the brochure for the location, address, and phone numbers of registries that are in or close to Kneehill County. Thank you for watching our presentation about applying for an Alberta healthcare card. It was created in partnership with MacEwan University nursing students and Kneehill Adult Learning Society. We hope you have a better understanding of how to register for and use an Alberta healthcare card. If you have any questions, please feel free to reach out to us at Kneehill Adult Learning.